54. My name is Savannah, and today I'm going to be discussing mental and psychological disorders. All of the information in the presentation has come from NIH, CDC, APA, and NIMA. So to start, I wanted to go over some of the objectives of the presentation. After listening, you should be able to understand what mental and psychological disorders are, who they affect, some of the causes of mental and psychological disorders, and lastly, the course of treatment as well as some new innovative methods. So, like any presentation, we have to go back to the basics and really define what mental and psychological disorders truly are. So, mental disorders can be defined as something that affects your thoughts, feelings, behaviors, and or mood. So, it can be a combination of these, one of them, or a few of them, but they are going to have an impact. So, a lot of them can be life altering. They can affect people's everyday lives to different degrees depending on how intense your symptoms are. Specifically, an example is like schizophrenia. So, in that case, in extreme cases, people aren't allowed to drive, operate vehicles, which could really impact their lives and abilities to get to place, to work, whatever it is. So, the severity can really influence the course of treatment and the level of impact it has on someone's life as well. So, they developed a spectrum that ranges from mild to moderate to severe in order to group them depending on the severity. They also are divided into two different categories. So they're going to be any mental illnesses, which is AMI, or serious mental illness, which is SMI. So those are going to be different because SMI is going to focus more on the severe levels of AMI, and those are going to have more effects on the person. Next, I have a list of the examples of mental and psychological disorders. I can't go into detail about all of them, but I will read them in order to give you some insight on some of the examples and kind of talk about a few of them. So we have panic disorders, personality disorders, phobias, post-traumatic stress disorders, psychotic disorders, schizophrenia, suicide, anxiety, bipolar disorders, compulsive gambling, depression, eating disorders, which you might know a few of them. Some of the examples are like bulimia, binge eating, or anorexia. We have mood disorders, which could be major depressive disorder, bipolar disorder, seasonal affective disorder, and lastly, one of the main known ones is obsessive compulsive disorder. So with a list as long as that, you'd think that there are going to be a lot of different causes, but to this day, there are only a few that are defined. Obviously, there's going to be different causes for each specific disorder, but the main ones are going to be genetics, environment, lifestyle, and your physical being as well. So within genetics, people who have close relatives or family members are going to be more likely to inherit genes that can cause the disorders. The environment where you live, where you work, obviously those are going to affect your emotional and mental state, which could also develop into a disorder. Lifestyle, so if you're living a sedentary lifestyle and you're increasing your use of tobacco or alcohol use, these are also known to impact your mental and psychological disorders as well. Things that are going to affect your moods obviously are going to play a larger role as well. And lastly, physical causes. So things like birth defects, chemicals in the brain, like I mentioned before, genetics, those are all going to be contributors as well to the disorders. So moving forward, mental illnesses are something that we're going to find globally. In this presentation, I'll mainly be focusing on statistics and information for most Americans, but this is something that's occurring everywhere that we go. There isn't a specific age or phase to mental illness. It's going to be kind of broad. We don't see it a lot as much in children under 14 because they usually do tend to develop around 14. But like I mentioned before, depending on the environment and lifestyle that someone has, it can definitely affect them as well. Gender is also going to play a role. We don't really see it as often in men, although that has been changing. It used to be more prevalent in women, but with this current day and age, we are seeing a lot more in men as well. And this isn't something we're just seeing within certain populations. It's even affecting celebrities, which has actually brought a lot of media attention towards the topic. If you keep up with the news or media at all, you'll know that just recently people like Kate Spade or Anthony Bourdain have taken their lives, and that's a result of a mental disorder. So going into that, I'm going to be talking about the diagnosis. There are three main tools that doctors will use to confirm and diagnose a mental illness. So, like I mentioned, genetics are going to play a huge role in mental disorders. So, typically, they'll begin by doing a medical history just to kind of see what's in your family and if that's a contributor. Depending on the illness, like I said, there's going to be different tests for different illnesses. So, depending on it, they might do a physical exam, see to what level of severity you're at. They also might do lab tests. Doctors will usually run tests when they think that the mental condition could be caused, their medical condition could be causing a disorder as well. So, like I mentioned earlier, mental illnesses are extremely common. The NIMH, which is the National Institute of Mental Health, states that nearly 1 out of 5 adults are living with a mental illness. So that's a lot of people. If you look at our class setting, we have probably about 30 people for 1 in 5 adults. That means within our own class setting, roughly 6 people would have a mental illness, and that's just too many people. Just 2 years ago, in the United States, they found that 44.7 million different people were living with mental illnesses, which is a big chunk of our population as well. 1 out of 17 Americans is going to develop a serious mental illness like schizophrenia or major depressive disorder, and half of the Americans have mental illnesses by the age of 14, which I also mentioned earlier. Within that age group, 75% of the health conditions are going to be fully developed. So they'll start by 14 and they'll continue to develop over time, and that usually it's diagnosable by 24 or 25 with a different level of severity. So with the rise of mental illnesses, it's really important to focus on how we're going to treat it because it is becoming a more common issue than it ever has been before. Treatments are going to vary, like I mentioned again, from severity and between disorder to disorder, but generally they're treated by using therapy or certain medications and prescriptions. Those are just going to be some of the most identifiable ways. There's going to be different types of therapy, different types of treatment, different medications. You're just going to have to talk it out with a physician and see what's going to work best for you as well. So a new innovative treatment method, I actually focused on virtual reality exposure therapy in my paper. So most of you guys know the idea of virtual reality as something that's been used as a form of entertainment. But it is changing and it's being used in medical practices as well. It's going to be used as a form of therapy. So they've developed it to place people in their place of fear or to be able to control their phobia and place them in a safe setting in order for the therapist to help them. So basically how it works is that people are placed in the setting and therapists have the power to increase the intensity and the different stages. So in a way, they're bumping up the fear in order to find the triggering point and work out a treatment from there. This has been really effective. I've seen it a lot in research about veterans fighting PTSD. In the pictures, you can see they give them the same utensils. They can see like exactly the same setting. They're putting them in the place where their fear began. So by doing this, they're seeing where it began to get triggered and they're putting them back and placing it in that same setting in order to see how they react and go through and fix that as well. It's also used to treat like phobias, spiders. I know a lot of us aren't fans of those, but arachnophobia is a real phobia, and that is a method that's used to treat it. So lastly, I just wanted to go over a resource to reach out for support. If you're ever feeling like you are experiencing a mental illness or suicidal or have any problems, it's always best to reach out to a physician, reach out to your friends, reach out to a hotline if you don't want to do a face-to-face contact, but there's always a resource out there for you. And thank you for listening.